So I start with the introduction of our academy. So Dr. Place Academy is on an online academy, and we have live classes, X-rays interpretation, ECG interpretation, non-invasive ventilation, clinical uses, antimicrobial, electrotherapy and thermography, ultrasound gynecology and OPS, ultrasound abdomen, recorded lectures we have on CT abdomen, neonatal resuscitation, CT brain, trauma management, and many others. So today we will start with my lecture. That is, I'll be talking on overview of MRI. Is my screen is showing? Can you see my screen? Please confirm that you are seeing the screen. Yes, I think the screen is now visible to everybody. So my topic is an overview of MRI. My name is Dr. Tauseef Qamar. I am from Lahore, Pakistan, and I did my MBBS from King Edward Medical College in 1985. And then I worked in radiology. I used to love this subject. I learned ultrasound first, and then I completed my radiology from Lahore. And I worked as head of department in Radiological Institute of Medical Sciences in University of Lahore. These days, I am head of radiology in Hussain College of Medical Sciences. And today we will discuss an overview of MRI. You can see this is a machine, a big sort of machine, and it contains a very strong type of a magnet, uh, which whose strength is more than 10 to 20,000 of the strength of the gravity force we usually observe. So it contains a very strong magnet with which we make images. So this is the beautiful machine we are seeing with the stretcher, with the patient. The staff nurse is talking with the patient. The patient has to be very calm and quiet in this examination. We don't want that he or she should vibrate or move, you see, to make best use of our test, and we try to make good images to study the organ we want to study. Another machine containing a big magnet. You see, this is the patient couch, and this is the image on the side. We can have very good, beautiful type of imaging due to MRI. MRI means magnetic resonance imaging, and we see very good internal details of the organs due to excellent tissue contrast. The beauty is the excellent tissue contrast which we get in case of MRI, which is superior to CT scan. In CT, we have ionizing radiation. Ionizing radiation can do harm to the body, but practically the uh, magnet and MRI, it is not harmful to the human body. There are precautions I will discuss. I will tell first, before going into the details of MRI examination, what are these precautions we have to take for MRI for the patients to observe those precautions so that they couldn't be harmed by this examination. Actually, the magnet is not harmful at all. So, starting with the safety in MRI imaging, MRI is in most cases assumed to be a very safe diagnostic modality. It is not invasive. Contrast agents can often be avoided. We use contrast agents, but we can avoid them also. Gadolinium is the most commonly used sort of this contrast agent we use. When used properly, no harmful effects have been apparent. However, there are drawbacks and risks. The strong magnetic field has probably no impact on the human body, but many metallic implants and pacemakers are not compatible with MRI, and deaths have occurred due to some accidents. Accidents happen when unknowingly the patient is having some metallic structure in his vicinity or in his body, and the strong magnet will pull that structure towards itself, and by that way the patient can be harmed. So ferromagnetic objects of any kind within or outside the patient's body, they are beds, wheelchairs, gas cylinders, fire extinguishers, tools, etc. They are of course strictly forbidden. The magnet is always on, and they can act as deadly projectiles, and if they happen to be pulled into the magnetic core, they cannot be taken away without quenching the magnet. We have to quench the magnet to release those structures. Now, coming to our subject, the MRI, and how we acquire the images, which is our aim, which is our target, to acquire good images. So, in many other type of radiological modalities, as we take the axial, coronal, and sagittal section, same is here. In MRI, we take axial sections, we take coronal sections, we take sagittal sections. Axial means that the long axis of the body, we perpendicular cut those sections, and we get an axial slice like this. And in coronal, we cut the body into anterior and posterior parts. So the picture would be something like this. And the sagittal sections, in that we used to cut the body into two halves, right and left, and by that way we see those structures. So this was axial, coronal, and sagittal section. In more detail about the this axial section, the patient's right is on left, and the patient's left is at our right, and anterior and posterior we can evaluate, but in that case we can't see the and superior or inferior part. Now, these are coronal sections. And in coronal sections, we can, the patient's right is at our left, and the patient's left is on our right, and we can assume the superior position, we can make out the inferior position in case of coronal images. In sagittal scanning, where we are cutting the body in two halves, we can imagine the anterior part, we can see the posterior part and superior part and the inferior part in case of sagittal slices. Then coming to our studies, what structures we generally see in the fetal skull, in the adult skull, in adult brain, which is commonly we do MRI of brain. It is requested many a times in our studies where MRI is requested. So the request for doing MRI of brain, MRI of skull is usually much in demand. So to start with, how we identify the structures of the skull onto MRI, this violet color is showing the skin and soft tissue. Then this is the red structure, which is actually the bone. I will show you in this short this clip that you can appreciate. This is the skin, and this is the soft tissue, and then under the bone there are meninges, the sheets which are wrapping the brain. They are 3 number, and we call them meninges. And the first one, the dura mater, is adherent to the skull bone, and second to dura mater there is arachnoid fascia, and arachnoid fascia is a very strong type of a membrane, and between arachnoid and the third, which is the pia mater. Pia mater is strictly adherent to the brain substance, and between arachnoid and pia mater there is a potential space, we call it subarachnoid space, and many a times we get pathologies in this space plus under the dura mater, and we will see them in subsequent slides. So to start with, this is the skin subcutaneous tissue, this is the skull, and beneath the skull, this is the dura mater first, then the arachnoid mater, and this greenish is pia mater. So between this pia mater and above there is subarachnoid space. This bluish is the brain, and this is the right cerebral hemisphere, and this would be the left cerebral hemisphere, and between them there will be falx cerebri. Now, these red lines, they show another membrane which are known as tentorium cerebelli on right side and on left side. This is the brain stem, and posterior to brain stem, this greenish structure which we have painted green is cerebellum, which is in the posterior cranial fossa of the brain. Now, this is on the posterior cranial fossa is cerebellum. This is the falx cerebellum. This is a coronal section. Now you are all watching a coronal section of a brain with skull intact, and you can see this is the right cerebral hemisphere, this is the left cerebral hemisphere. Between these two cerebral hemispheres This is falx cerebri, which separates them. And inferiorly, this is the tentorium cerebelli of right side. This is tentorium cerebelli of the on the left side. And beneath it, these tentorium cerebelli lies the cerebellum, which is painted green in this uh, picture. This was coronal. Now we comes to this midline sagittal section, and we can see this is frontal bone, this is occipital bone, this is the major part of the brain, the cerebrum. So this is the cerebral hemisphere. The two cerebral hemisphere, they are joined by a structure which is known as corpus callosum. We can see it, this structure very well. And you can see below the cerebral hemisphere on posterior side is cerebellum. And anterior to cerebellum, we are seeing the brain stem. They are very important structures in this midline sagittal section, and I just will show you these structures. First of all, we discuss what are the CSF spaces seen in case of the brain while doing MRI. We can see the lateral ventricles, which are just near the midline. On some sequences, they appear bright, like on T2 sequence. I will discuss what is T1, what is T2 sequences. On T2 sequences, it appears bright, this fluid. So milky bright, usually it appears on T2 sequences. And this is the first space where the CSF is produced by the forehead plexus. We all know. Then we see this is the anatomical diagram of the brain showing you that there are many projections and there are some sulci. The sulci are like depressions, and the projections, they are known as gyri. So gyri are projections, and sulci, they are depression. And the sulci, they contain that CSF as well. So that CSF can be appreciated by the on MRI. On T2 sequence, it will look bright because the fluid will look bright. So there will be some bright tinges, and they show that this is the place of the sulci. So CSF we are seeing in these sulci, and around these sulci will be the gyri. The gyri, they are like a projection over the brain. So these projections you can all appreciate, and the sulci, the depressions, you can all see on this anatomical diagram. Now coming forward, we see that this is an axial section of the brain of an adult patient, and the bone is around, the subcutaneous tissue is around the bone. And then these are the meninges, and this is the brain substance. And the two hemispheres, there is this fissure-like structure in between, and we call it interhemispheric fissure. This yellowish line represents interhemispheric fissure. So this represents midline. So the midline shouldn't be crossed at all in normal anatomy. If it is crossed, that represents that there is some pathology due to which the midline is crossed. Then we have colored these lateral ventricles, which actually appear, they should appear milky white, but we have colored them blue. So they are the lateral ventricles. The lateral ventricles, they have got anterior horns on anterior side and posterior horn on posterior side, and on some sections, some deeper sections, we can appreciate them. This is the interhemispheric fissure anteriorly, and this is the fissure which is lying posteriorly. Again, we can appreciate this interhemispheric fissure between right and left frontal lobes of the cerebral hemisphere, and these are the lateral ventricles. The anterior horns are there, and the posterior horns are there, and the lateral ventricle body of the lateral ventricles are not seen as previously we were showing you in that section. So this section does not show you the bodies of lateral ventricles, but instead they are showing you the anterior horns and the posterior horn of the lateral ventricle. Now, going forward, we can appreciate this interhemispheric fissure. Then we are seeing this the lateral ventricles there, anterior horns. Then the foramen of Monroe. We are seeing this the foramen of Monroe. Then these yellow lines, they are Sylvian fissures, and this is the third ventricle. They are in between two thalami. We'll see them in another section to make our concept more clear. And these are blue ones. They are the posterior horns of the lateral ventricles. Here, this yellowish line represents the Sylvian fissure, and again, this is the anterior horn of the lateral ventricle. Now, coming to the base of the skull and coming to the inferior part of the adult brain, we can appreciate these are the eyeballs and the structures around the eye. And in the brainstem part, we can appreciate this greenish area, which is actually the basal cistern. Basal cistern also contains CSF. So CSF is in the lateral ventricles, in the third ventricles, in the fourth ventricles, in the sulci, and in the spinal canal. But here in the basal cistern, we can also see the CSF. And this reddish part is known as fourth ventricle. It also contains the CSF. And the fourth ventricle communicates with the third ventricle through the aqueduct of Sylvius, and I will show you in a moment that structure as well. They are very important structures to visualize for the to see the integrity of the brain, or whether these structures are affected or not, and to define many pathologies, keeping those structures in our mind. So this is the sagittal section of the brain, showing you the midline sagittal section, and this part, this structure is known as corpus callosum, as I have already told you that it integrates the two right and left hemispheres. It has got some parts, we will see them, we will appreciate them, the genu and splenium part of the corpus callosum. This is the brain stem, and behind the brain stem is this cerebellum. And there are few structures which are anterior to the brain stem. They are very important to see and to visualize and to report. Now, we can see in the midline, this is the third ventricle. People who are doing ultrasound will they will know that while doing the ultrasound of the intrauterine fetus in third trimester, they can see the well-formed thalami, and in between the thalami, they can see a slit-like structure, which is known as the third ventricle. But here on MRI, in adult case, we can see the total dimensions of this third ventricle in midline sagittal section. This violet colored structure is the third ventricle, and it is connected to this greenish tube-like, narrow tube-like structure, which is known as cerebral aqueduct. And cerebral aqueduct will continue to meet the fourth ventricle. This is the fourth ventricle, and this is the cerebellum. This is the brainstem, and anterior to the brainstem, this is the pituitary gland, which occupies the pituitary fossa. So pituitary gland is very important, and we usually report and we see its integrity, whether it is normal or it is associated with some problems, pathologies or not. And we can also appreciate the pituitary stalk as well. So pituitary stalk can be seen, visualized on MRI examination. And superior to pituitary stalk, there is a structure which we have colored this blue. It is optic chiasma. So we can appreciate these small, delicate structure, optic chiasma, pituitary stalk, pituitary gland, anterior to the brain stem, and posterior to brain stem, we can see the fourth ventricle, the cerebral aqueduct, and third ventricle. The cerebral aqueduct is usually blocked. In case of ventriculomegaly, we called it hydrocephalus. So usually, this structure is generally blocked when we see the this hydrocephalus of ventriculomegaly. Now, this is the cerebellum, and we are seeing the axial section, and we are on the inferior level of the brain scanning. So these are the eyeballs, these are the temporal lobes of the cerebrum. This is the cerebellum. So we are in the posterior cranial fossa, and in posterior cranial fossa, we can see this is the right ear, this is the left ear, and we can also appreciate some other structure, very fine structure, like the cochlea, which is the structures near the internal ear, then semicircular canal on right side and on left side, the semicircular canal, which are associated with the balance keeping of a patient. Then this structure, low density structure, is basilar artery. You see, it is here, we can appreciate. And these two orange lines, they represent facial and vestibulocochlear nerve. So these important structures of posterior cranial fossa can also be appreciated and seen on MRI. Now, the lobes of the brain, we can appreciate them. The right frontal lobe, the left frontal lobe. This is the boundary of the right parietal lobe, the left parietal lobe. And going inferior, we can see this brain stem. And behind brain stem, this is the cerebellum. The anteriormost part of the cerebellum is peeping in between these two right and left occipital lobes of the cerebrum. So this is the right temporal lobe, this is the left temporal lobe. So we are seeing all lobes, frontal, parietal, temporal, and this is the occipital lobes in various sections of the MRI of axial section of the brain. Now, we can appreciate the gray versus the white matter. We all know that in case of brain, we call some part as gray matter and some part as white matter. And we can appreciate the gray matter is superficially placed, and the white matter is mostly inside of the gray matter. So in this diagram, we can appreciate this outer is gray matter, which we labeled it as this reddish line, and this is the white matter, which we have put white. So the other structures on MRI, in between, in the white matter, there are some nuclei of gray matter, which are of utmost importance. These are, I have already told you, this bright area, these bright signals, they represent the anterior horn of the lateral ventricle. Around them, these green labeled structures, they are the caudate nucleus. And these yellows, they are the lentiform nucleus. And just behind them, near the midline, these red nuclei, they are the thalami. This is the right thalamus, this is the left thalamus. And this section was an axial section. And this is midline sagittal section. And we can see all parts of the corpus callosum here. This is on axial section, we can appreciate this is the genu, where there is a bend, and the posterior part, we call that splenium of the corpus callosum. So these important structures can also be visualized and seen on MRI examination. Then the arteries, how they are visualized. There is a main circle of Willis, and we all know that how the circle of Willis is formed. The vertebral artery is there, and the basilar artery is formed by the two vertebral arteries, and the internal carotid artery divides, and it helps to form us the circle of Willis. And the circle of Willis can be seen on MRI. Then the veins are very important. This is the inferior sagittal sinus, the superior sagittal sinus, this is the straight sinus. The arteries we study them on MRA, and the veins are seen on MRV. We call it magnetic resonance venograph into the sigmoid sinus. This is the sigmoid sinus. We were talking what is called T2. There is a sequence. In a sequence, we acquire images, and we call those images Should I start? Should I start? Am I audible? Please let me know. Am I audible? Thank you. Thank you. Now, this is very important slide to show that we were talking about T1 and T2 sequences. So in T1, the CSF, it looks dark. And in T2, it looks bright like a milky bright. So in T1, the anatomical details are more evident. And in T2, the pathological details are more evident. So this is the T1 weighted images, and this is the T2 weighted image. So we will, if given me an opportunity again, I will discuss these sequences in detail in subsequent lectures. Now, shortly about talking on how the T1 weighted images, they look like. This is the T1 weighted image. This is one T1 weighted image, coronal section showing you the right and left cerebral hemisphere. This is the cerebellum below these two hemispheres. And this is pre-contrast and post-contrast axial sections of a patient. Then the T2 weighted images, it has got various further types, and the further manipulation of sequences will yield us many other sequences. We call them the stair. It's a part of T2 weighted image, the ADC, the DWI image, the SWI image, and T2 star image. So we manipulate our machine in such a way that we create multiple types of sequences. And these other types of sequences help us to find and you see to see the pathology in the uh, uh, best available details. So that is the main motto to make the further sequences of the main sequence. The main sequence is T2 weighted, and we further made small changes in the sequence, and we can. I think I am audible and I can be seen. Okay, I start. There is another case. There is a man who was uh, 75 years of age, and he had brain surgery. And after brain surgery, he got some problem, and then MRI was done. And in MRI, it was seen it was seen that this is the skull bone. Beneath the skull bone, you can see the sulci and gyri. They were not that much visible, clearly visible. And there was some homogeneous area, small homogeneous area, which is you see covering those sulci and gyri. And we came out with the idea that this person, due to this surgery, got this subdural hematoma. So on MRI, the post-surgical subdural hematoma was visualized like this. It is visible like this. This is T2 star. This is T2 sequence. This is pre-contrast T1, and this is the post-contrast T1. So we confirm that this post-contrast, we confirm that we are dealing with subdural hematoma. So it was subdural hematoma, which we confirm uh, in on email. She got MRI due to some CNS symptoms and density, low intensity area in the right side of the brain. This and, and on this was axial section, and this is the coronal section. So persistently, we saw these two low intensity or hypo-intense structures on right side of a brain of that woman. Again, we saw them uh, this again this their echo density or their on MRI like this. So we confirmed that. Now, go to the venous eye screen. Thank you. So, while doing the MRV, which is magnetic resonance uh, of the venous system, we can see, appreciate on right side, this is the venous blood seen in the sinuses of right side of the brain. They were intact and they have got this flowing blood inside. But on left side, there was, due to the thrombosis in the venous sinus, there was thrombosis. So there was absence of these bright signals. So these hypointense area confirms that we are dealing with venous sinus thrombosis on left side of the brain. So thrombosis of left side of the brain looks like this on this MRI. And this axial section of MRI showed that there is a venous sinus thrombosis along with parenchymal involvement as well. So it was confirmed that the venous sinuses, they were involved. Now, another very common pathology, we have got this disease which is known as multiple sclerosis. It's a disease with varying types of symptoms due to, as it is the demyelinating disease. There is demyelination of the fibers of the parts of the brain. So there is demyelination, and this demyelination leads to multiple and many fold symptoms. And you see, in that one of that case, we picked up this bright signal here in the cerebellum. We picked those abnormal signals in the cervical canal, and we picked that bright signal around in the midline sagittal section, affecting the this corpus callosal area. Near the corpus callosal area, we saw these bright, multiple bright areas. So it was diagnosed that it was a case of multiple sclerosis affecting different parts of CNS, and it they looked like this pathology looked like this on MRI examination. Now, there is further an interesting case. A 56-year-old female, she complained of headache and memory loss. There was change in behavior. And what we saw on this axial image showed us that there is a ill-defined mass, big size mass in the temporal lobe of the left temporal lobe. So mass in the left temporal lobe was seen on this axial image. So we further did MRI with multiple other sequences, and I'm going to show you those. This was on T1. So on T1, there is very ill-defined, very subtle type of mass, but it is enlarged, diffusely enlarged. It is not clear-cut here. But after giving contrast, this is the, now I'm showing you that how the injection of contrast help you to to be sure that you are dealing with some pathology. So look at this bright outline of these lesions. So they are definitely brightly outlined abnormal lesions in the left temporal lobe of that woman. And I will show you just now that what it came out to be. And this is another sequence. This sequence was T1 weighted, pre-contrast and post-contrast. And these sequences are of T2 in the form of DWI and ADC. They are further subtypes of T2 weighted images. And in subsequent lectures, uh, if given me the opportunity, inshallah, we'll do these. What is these DWI? What is this ADC image? And on this DWI and ADC images, we can appreciate this pathology affecting the left temporal horn of that lady. And collecting all these images and comparing them, this one, this, and this, and again seeing them collectively, we came out to be on our inference that we were dealing with a glioblastoma. So a glioblastoma is a tumor of glial tissue, and glial tissue is supporting tissue to neuronal tissue. Basically, the brain and spinal cord, they are made of neurons. But to support neuron, the parenchyma of the brain also contains the glial tissue. And the glial tissue, sometimes they get their tumor and we call them glioblastoma. So she was suffering from that disease. So we picked up a glioblastoma in the left temporal horn of that lady, and we did all this MRI sequences. We did T1 pre-contrast, we did T1 post-contrast, then we did T2 image, then the subsequent sequences of the T2, like T2 star, the DWI, and we did ADC. They were further subtypes of T2 image. Now, what are the indications? Just as I have discussed in detail the brain anatomy on MRI, some pathologies of MRI, how they look like on MRI, these pathologies. Just to finish it, I'm just talking about what are the indications for MRI in case of brain. So they are the stroke, they are tumors, aneurysms, headaches, brain injury from trauma, brain tumors, hemorrhage, seizures, spinal cord conditions, vascular anomalies, congenital abnormalities, dementia, eye health, hydrocephalus, infections, inflammations, liver diseases, multiple sclerosis. They can, in all those conditions, MRI is indicated. Further down in the body, the magnetic resonance imaging is increasingly being used for diagnosis and follow-up, and we can do it in spinal cord. There are multiple indications, the musculoskeletal system, in abdomen and pelvis, there are multiple problems. We can do it even in cardiac. We can do even in ischemia, tumors, infiltrative disease, congenital malformation, the vascular studies, and even in pregnancy. As I have already told you, that the MR, the magnetic resonance, basically the magnet is not harmful to the body. So we can use MRI in case of even in pregnancy. So for further, we can in subsequent lectures, if given me opportunity, I will tell you the parts, what will be the further detailed parts of the MRI machine and how it works, and the basics of the MRI physics. So it was an overview today to start with this MRI, but in subsequent lectures, I have prepared them that I will tell you the more about its physics and how what are the physical principles which govern the MRI, by how we take this T1, what is mean by T1, what is mean by this T2 relaxation times, and how the hydrogen atom is there, how it is spinning and how it is behaving in the that strong magnet, and how the RF pulse we give, the radio frequency pulse we give, and how it changes the behavior of the hydrogen atom, and how the images are then made and formed. They will especially help for those MRI technicians who are appearing in exams, and especially and also to the radiology residents who want to learn about MRI physics, because MRI physics is not simple, it is not easy, it's difficult subject. So we will discuss them subsequently. I think for today it's enough. I will thank the organizers. They have given me the opportunity to talk, and inshallah, subsequently, if given permission, I will be teaching more and more about the MRI and the radiology, which is my passion. And I thank you all for bearing me up till now. And I'm just showing you some of my slides of the MRI physics, which subsequently I have prepared for further lectures. Thank you. Thank you very much.